So, hello, doctor. Welcome to the health site.
Hello, thank you for having me.
Pleasure, doctor. Doctor, so as we know that today is National Cancer Awareness Day, and we will be talking about breast cancer today. So one of the major thing that a lot of women deal is breast cancer. So, doctor, what are the some basic causes of breast cancer?
Yeah, like you said, breast cancer is one of the biggest cancers that we are battling with in our country right now. There is no exact cause as such for breast cancer. We do have some what we call risk factors. And so the common risk factors are an increased exposure to the estrogen hormone, which happens when people have periods which start very early or their menopause is very late. When we have few pregnancies, when we don't breastfeed our children, these are some of the risk factors for getting breast cancer. So, as we are seeing more and more later pregnancies and less breastfeeding in the country, definitely that is one of the things. Second is if there is anybody in the family who has a history of breast cancer, that automatically puts us at an increased risk for getting breast cancer. These would be the common causes.
All right. So, doctor, moving on, if we talk about the detection of breast cancer, how is it done? How is breast cancer detected in our?
So, commonly in India, most patients come to me with a lump in the breast. And they say, ma'am, I felt a lump in the breast for 2-3 years and 2-3 months. And can you tell us what it is? That is how breast cancer is usually detected. For screening, that is to prevent breast cancer, we have different ways of doing things. One is a self breast exam where you learn to examine your own breast and do it monthly once. Second is a clinical breast exam where you go to the doctor and have him examine you once a year. And third is a mammogram, which based on the patient's history, we will tell when to start getting the mammogram and how often. It's an X-ray of the breast that we take that will help us in detecting cancers at a very early stage.
Doctor, while talking about detection, breast detection, how is it detected? You said that self-examination can also be done from a person's end. So, how is that self-examination done?
So, the self-examination we recommend mainly to have women be more breast aware so that they remember that the breast as an organ exists and that it is important to screen for cancers. Now, when we examine the breast as a physician, usually if the tumor is even 1 centimeter in size, I can make out. But as a normal lay person, it might be a little bigger. There are some things we need to be careful about when we do a breast self-exam. A lot of videos are available on YouTube on how to do it. But the main thing is that you have to do it monthly once, preferably 2 to 3 days after your periods are over, when the breasts don't feel so swollen, and to not miss any area in the breast. And that all the videos show. But commonly missed areas are under the breast, where we forget to do the palpation, and under the arm and in the area leading up to the arm, and this top areas. So usually these three areas are missed. So these are the areas that need to be examined and remembered when we are doing the breast surgery.
Also, doctor, while looking for the detection, as you said that we have to examine the entire area of the breast. So we have to look out for a lump in that?
Yes. So you have to look for a lump, and the first time you are examining your own breast, lot of it might feel like lumps. Okay, so if you do it regularly, then you get an idea of how your own breast feels. That way, if there is even a little bit of a change, you will be able to seek care with the doctor. But you're looking for lumps is one thing. Second, if there is any discharge from the breast. And third, if there is a nipple retraction where the nipple goes inside, that and some skin changes, all this in a self-breast exam, a person should be able to make out.
All right. Doctor, moving on to the treatment of breast cancer and the stages of breast cancer. So I'm obviously sure that according to the stages, the treatment must have been done. And according to that, according to detection and according to the stages, the treatment is provided to the patient. So what is the treatment, if we talk about the stages, what are the treatment involved?
So I think there are several questions in that. First, I would like to start by saying that when we say breast cancer, all breast cancers are not the same. And we have at least 3 types of breast cancers that we look for in a patient. So as a doctor, when somebody comes to me with a lump in the breast, my first step is to do usually a mammogram or an ultrasound of the breast, followed by a biopsy of the lump. A biopsy is a procedure where we take a small piece from the lump and send it for testing, where they look at it under the microscope. This is done to confirm the diagnosis of a cancer. So there is no test other than a biopsy that can confirm the diagnosis of a cancer. So PET CT scans, mammogram, ultrasound will only tell us that maybe this is a cancer, but the confirmation is only by a biopsy. So that is the step number one. Step number two, we do is what is called immunohistochemistry, special tests to see what type of breast cancer it is. Third, by doing a series of tests, which might be anywhere from a PET CT scan to a chest X-ray and ultrasound and bone scans, we try and see what is the stage of the cancer. Is it localized only to the breast? That would be a stage 1 or a 2. Is it gone to the axilla? That would become a stage 2 or a 3. Has it spread anywhere beyond the breast to any other organ? That would become a stage 4. So by doing these tests, we know whether it is stage 1, stage 2, stage 3 or 4. So confirm the diagnosis, know the type of breast cancer, find out what stage it is, and then comes the treatment plan. So a treatment plan for the breast cancer requires the inputs of multiple specialists, not a single person. So a medical oncologist, the person who gives chemotherapy and hormonal therapy, a radiation oncologist who does radiation, and a surgical oncologist who does the surgery. So it is very important that all three doctors, with the help of the pathologist and the radiologist, sit together, understand the stage of the tumor, the type of the tumor, and then come with a treatment plan which is individualized for that particular patient. So I might have a 2 centimeter lesion in the breast, and the treatment will be different for different people based on the type of breast cancer it is and what stage they are coming in. So it is very important that all specialists sit together and make a decision on what is the sequence of treatments that we have to do so that the patient has the best chance of getting cured.
All right, doctor. Doctor, I think this is a very educational topic, and a lot of people, and especially a lot of women, should know about this. So I've chosen this topic because on this Cancer Awareness Day, I think this is the perfect topic for anybody who would like to hear it about the detection, because a lot of people have confusion about the detection. And of course, in many cases of cancer, people do not recognize the early symptoms. And of course, because of the detection did not happen on an early stage, and that is why it's carried on forward. So thank you so much for doctor for talking to us and talking to the health side. Thank you so much.
Thank you very much.
Thank you, doctor.